A typical person on Medicare pays at least $174 a month on their health insurance. So if you thought there was no cost to Medicare, like me, think again. Hello, welcome to my channel, The Imperfect Human Systems. In one of our videos, I talked about my dad's diagnosis of vascular dementia. In this video, the objective is to go over the medical costs that incurred during his hospital stay. Yikes, the medical bill totaled almost $140,000 for 4 nights in the stroke acute unit. What do you think about the total medical bill? Now, can you imagine if you didn't have any health insurance and you had to pay out of pocket for that amount? That can wipe out someone's life savings. All right, so I have the medical cost on my lap right here, and we'll just go over the different items. The total bill came to almost $140,000. He did receive a head CT scan, a CAT scan of his head, and that came to $3,749. So you might ask, well, why that? And that's because he had, originally he was being seen for the dementia, and that's because he was confused and he wandered off. We wanted to make sure there was no bleeds, nothing structurally that may be cause for his confusion. Now also, one of the things that happened during his visits to primary, that the primary caught a murmur that she did not hear before. So she wanted him to be worked up with the cardiologist. The cardiologist wanted to order a 2D echo, which is a non-invasive study where they can look at the specific organs. In the case of my dad, it was his heart. So usually a technician wheels in this big machine with a monitor, and there's a wand that he or she will place on the skin, in my dad's case, his chest. And the monitor will record a recording of his heart. The 2D echo for my dad was a little over $6,000 just for that one test. EKG came to $467. That's when the tech would wheel in. They place several electrodes, and you'll see a screen. Well, there's a graph that shows your heartbeat, and usually it'll tell you whether you're having a heart attack. It's a typical test that one does in the hospital, especially in the emergency room. Now we come to the emergency room visit. That came to $9,800, and you may ask, well, why the emergency room, EJ? Well, that's because what prompted his visit to his primary care was my mom saying that he was confused and he was lost, and he wandered off without having a real clear reason why he wandered off. Because of that, she wanted to get that head CT completed to the next item, the IV intravenous therapy. For him, I'm assuming this included the 4-night stay as well as what was done in the emergency room. And then you have the laboratory. Again, this amount was, I think, a lot, $15,600. I'm assuming he got these done in the emergency room. Standard blood work they do is look at your glucose level. Well, his was over 300. Now he's been taking metformin and oral medication for his diabetes, but anything that's a value of 300 and over requires immediate attention. And that was really the reason why he stayed for 4 nights, was to have that under control before he was discharged. The laboratory included those finger sticks that he had. The next thing, his MRI, the magnet resonance imaging, $18,546. So he had it done for his spine. You might ask, well, why that test? Well, when he went in to see the primary, he was also complaining that he had these tingling sensations along his legs. So the MRI is really good for looking at the bones, the dense structures of your body. The medical and surgical supplies was a little over $1,200. Those are probably things like the syringes that were used, the needles, the catheters that were used. Some of the other items that he received is the occupational therapy. An occupational therapist would come and help the patient perform, go through some of the daily activities like brushing your teeth, as well as getting dressed. We had the occupational therapist visit my parents' house because he would be considered a risk for fall, that there was nothing in the home that may trip him. There may be things that he could slip on there. So we did modify certain things to make sure that the other items that were very expensive was all his drugs that were received in the hospital. And that was over $8,000. As I mentioned about his glucose being high, more expensive medication was insulin, which he received several times. One other medication that I wanted was the Crestor. He received one pill of Crestor, and it's $138 for one pill. It seems so expensive. And the last item I want to go over with medication, pain medication. I wanted to go over this because in my dad's case, and a lot of patients too, is that sometimes they underreport their pain level. And he also received physical therapy. Physical therapy is important in this case because he did mention the weakness and the tingling of his legs. Physical therapy really focuses on the kinetics of the body movement. The next item, the last one, the treatment or observation room, came to almost $61,000, the treatment or observation room. And this is the actual bill for staying in the hospital room for 4 nights. So that's over $10,000 a night. Very expensive. Well, if you're going to be admitted, that you're going to be looking at a pretty hefty bill. And I know that Medicare did cover it, but it doesn't appear to be that simple, because in dealing with my dad's admission, there's a disconnect between the healthcare system and our health, specifically in the case of diabetes management for my dad. So the 300 blood glucose level and higher that he had that led him for this admission should have been caught several months prior to having the emergency room find this. As being a healthcare provider myself, as a registered nurse, that ultimately your health is really in your hands and your responsibility, that there's no oversight. So if you can, is to stay healthy as long as you can. Until next time, be well.